Hello, my name is Britta Blake with Baker Hop and Associates. On today's call to action interview, we have Lisa Daniels Goldman, mother of Jamie Daniels and founder of the Jamie Daniels Foundation. Lisa, thank you so much for being on Baker Hop's call to action.
Thank you for having me, Britta. I appreciate it.
So, Lisa, after reading Jamie's story, I was overwhelmed with emotion, not only for your son, but also the information that followed after his death. If you wouldn't mind, Lisa, I would love for you to tell our audience more about Jamie and the foundation you created in his name.
Thank you. Well, Jamie was 23 when we found out he had died on December 7th, 2016 in Florida, where he was undergoing treatment, and he had been in recovery now for 7 months at that time. And you know, when he was home and living here, when we became aware of Jamie's substance use and searched for help, we found it really difficult to find reliable resources to help evaluate and guide his treatment. And he had gone into an inpatient recovery here in Michigan, and unfortunately, after 2 weeks, he was done, and we had no guidance from there. And 2 weeks after he left that inpatient treatment, he relapsed. And basically what we thought was pretty much his lowest point, I did finally find help from a therapist here in Michigan who had trained in Florida and recommended an inpatient recovery center. And we ended up, after Jamie went into the hospital for his detox here, we sent him down to Florida, where he did go into a very reputable treatment program. And, after his 2 weeks there, he called and he said, "I'm just not ready to leave." And we were happy to have him stay. And they let him stay for another week or so. And we followed the guidance that we were given. We were sort of thrown into this realm of not knowing anything, and we didn't understand anything, and information was very difficult to get. And what we really didn't know was the predatory practice that existed in this billion-dollar business of substance use recovery. And unfortunately, after Jamie was discharged from his inpatient, he had moved to a couple of different sober living homes and was manipulated by the system, and in the end was prescribed by a medical doctor a generic prescription for Xanax for his depression and anxiety. And within 4 days of that doctor's visit, he ingested a synthetic opioid that was laced with heroin and fentanyl. And what we came to find out later was that the house manager in the sober home that he had moved into did not have Narcan, naloxone, which could have, had he been given it, could have potentially saved his life, and Jamie would have still been with us today. And when we found all of this out, which was unfortunately after the fact, several months after, as his medical bills started coming in, and we realized that while we thought Jamie was in the care of the professionals down in Florida, we realized that really for 7 months, he had been on his own and wasn't being looked after, but was manipulated back into the system because he was worth more with his insurance, needing recovery and being hooked on medication than maintaining his recovery. And in the end, we found that our insurance had been falsely charged upwards of $60,000, which is minimal for some. And as recently as July, one of the doctors who had mischarged, I guess, the insurance was just arrested by the FBI, and it was determined that he had fraudulently charged the insurance companies upwards of $681 million. And, you know, it's a very in-depth story. It's complicated, and not knowing where to turn, not knowing now who to trust. It's so difficult to maneuver in this world. So, in fairness to Jamie, we wanted people to know that he wanted to recover. He begged for help. You know, one part of his brain begged for help. The other part said, I'm not going through that withdrawal again. You got to give me these pills. And it is not something that somebody chooses to do. Nobody wakes up in the morning and says, I want to be an addict today. We know now that, you know, these big pharmaceutical companies sold medications to doctors as being non-addictive when they were addictive. We know that there are medications out there that are easily prescribed that within 5 times ingesting them can hook someone on that pill. And it is so difficult because your brain physically changes. And it takes more than a 2-week detox or a 28-day stint in recovery to get through and maintain recovery without relapsing. It takes upwards of 2 years to do that. And that's what we're working hard on. And that's why we needed to come out and let people know what happened to Jamie and how we, you know, going back and looking back on things when he had, you know, adolescent anxiety. And he did for all his life. He had some kind of depression or anxiety that, you know, as a mom, and he was my firstborn, I didn't understand. And you go through adolescence and you have anxiety, you know, first boyfriends or girlfriends and struggles with friends and kids being mean. And Jamie had anxiety that was misdiagnosed as ADD. But the generation that he's grown up in, which was actually the social media world of all these apps being created, at the same time he was growing up, you know, an adolescent, a 13-year-old, a 15-year-old, a 17-year-old, where all of these social media apps came into play, where we didn't realize what it was causing our kids and how it was causing our kids distress, depression. We know that now, but I had no clue. You know, I grew up with him with it. I remember when he was a toddler getting dial-up internet into my house for the first time. So we grew up with it together. We know now for younger kids, but we really didn't know then. And I think a lot of kids that were diagnosed with certain mental health issues or ADD or something, because they needed a name on it, can be related back to social media because they can't turn off. And we were lucky enough to be introduced to the Children's Foundation. And back in 2018, when we started the Jamie Daniels Foundation, their initiative was a mental health initiative for children. Obviously, they work, you know, from birth to about 26, and we fell right in there. And for the last 2 years now, just over 2 years, we've worked together, and they've helped us create what the Jamie Daniels Foundation is today.
Now, Lisa, you had touched a bit about, you know, recovery. It's not a 28-day plan. It's maybe more than 2 years. You don't know how much recovery one individual person needs. Everyone is different. So I know we touched on this earlier in our conversations, but I'd love to hear, you know, where the Jamie Daniels Foundation is in store for the future.
Well, we have proudly, after our first year, we proudly wrote our first grant to the Michigan State Collegiate Recovery Program. I believe back in 2017 or 18, they did a survey and determined that there were more than 1,500 kids on campus that identified with having been in recovery or were currently in recovery. And they created an incredible program there that we highly support and did again this year. Our grant enabled them to pay for a full-time peer recovery coach And this year they also established the Jamie Daniels Memorial Scholarship for kids either coming back to their studies or going to university for the first time, but having come out of recovery and needing the support on campus, which could otherwise be a very difficult environment to navigate. In addition to that, when COVID hit in March, we, along with the Children's Foundation, created the COVID-19 Emergency Relief Fund. And we were able to write grants in the amounts of about $10,000 each to 3 organizations around Michigan that help support teletherapy for those in recovery who couldn't now go to in-person meetings, for people who had lost their jobs but were living in sober living homes and needed to continue to pay their rent and were unemployed now. It helped pay their rent. So those were some of the areas that we helped out with the COVID relief, which is still ongoing. And then just this past summer in June, we wrote again 2 new grants, again one to Michigan State and to a new program in Dearborn, Michigan, which is a program that was developed for 9th and 10th graders and their families for prevention and recovery, and to teach the kids and their families about drugs and the prevention of, because unfortunately Dearborn has a high population of those with substance use disorder.
So Lisa, how can individuals like myself or Baker Hop get more involved in your mission and the Jamie Daniels Foundation?
Well, what we have coming up actually on Wednesday, the 14th, is our 2nd annual Celebrity Roast. And this year, our guest of honor is Scotty Bowman. And while, like everybody else, we have gone virtual, and Fox Sports Detroit picked up the virtual event for us. So it will be aired at 8 p.m. on the 14th on Fox Sports Detroit, but it will also stream live. So anyone can watch it from anywhere, whether you're in Michigan or across the state or in Canada, and be entertained, but also be educated. And you may laugh, you may cry, but certainly we need your support. And it is our biggest fundraiser. But we actually also just started a program at the Jamie Daniels Foundation called Jamie's Journey. And what we've done with that is we're inviting people to come and listen to Jamie's dad and I and hear Jamie's story. We're not asking you for anything but to listen, to ask questions, and maybe something that we say or you can relate to, and that you'll invite maybe friends or family to listen, just to get the word out, to let people know that we're there and that the Jamie Daniels Foundation exists to provide resources and education and guidance in this world of substance use disorder. And those are a few of the ways that we can do that. Certainly, if you've got a Facebook page and your birthday's coming up, you can do a fundraiser for us. We did lose out on a few of our in-person fundraisers that we were doing. We do have an online, which is still ongoing. Certainly, we want to try to get rid of the stigma that surrounds and precludes recovery with addiction. And we have been selling sweatshirts and t-shirts with a cross out stigma and to shape our future. And, we want people to be able to ask for help. And that's the most important thing, is the support and help. So, if you have a company and you have social media and you can follow us at the Jamie Daniels Foundation, we would love that. I would invite you to visit our Facebook page and like us there, our website, jamiedanielsfoundation.org. And certainly those are several ways that you can help support us, and donations are always welcome.
Lisa, thank you very much for sharing Jamie's story and the information you provided about the Jamie Daniels Foundation.
Thank you so much, Britta, for having me.
And for our audience, I urge every single person to read Jamie's story. It is overwhelming, yes. It is emotional, yes. But it is something everyone can learn from and take a piece away. So I will be providing more links in the attachments above. So please go see the JamieDanielsFoundation.org. Thank you for watching. Stay safe.
Thank you.